Hi guys, welcome back to another one of my Drive With Me to Work sessions. I am Devin, I'm a pediatric nurse practitioner. I am going to tell you about what I've been seeing the most in clinic right now and how I've been differentiating or trying to differentiate between the three and kind of things that I look for. So I would say the biggest three things right now that are going around that everybody knows about is influenza, so the flu. Another virus that looks like the flu but has been testing negative for the flu, but similar symptoms. Some more strep has been going around, and then I've started to see a little bit more of hand, foot, mouth. So the biggest thing with all three of these things is that they can all cause high fevers. They can all cause sore throats. So how I kind of tell, or my first glance at a patient when they come in and I'm kind of trying to decide if it's something I'll be testing, obviously I get a full history on them, but I would say for more of like geared towards other people and knowing hand, foot, mouth, typically you're always going to have some sort of sore, whether it's on the hands, the feet, the mouth, lots of times the butt, or even other parts of their body. If it's little kids, they probably aren't going to want to eat. It's probably going to hurt to eat like fruit pouches because they're going to be going on to open sores. If they go in the bath, that might hurt because they might have what we would call as little like vesicles in between their toes or their feet that might not be visible. And they might also have just very faint spots starting to form on their hands or their feet that you might not pick up on. So typically if it's a younger kid, I will think that. For the flu, they'll have really glassy, watery eyes, and lots of times more of those viral symptoms with runny nose, cough. The fever I have been seeing has been very intermittent. So what that means is they'll have a high fever one day, it'll go away for a day, then it'll come back. It'll go away for a day, and then it'll come back. Lots of times that's with viral stuff. Bacterial, lots of times I'll see is that a fever will stay. So strep, typically you get a fever and it'll be high and it just isn't going away. Other thing with strep is that lots of times they will have stomach aches, headaches, feeling of nausea. Have also been seeing that with the flu, but not as much of like the cough, runny nose symptoms. If it's that school age kid, I'll be testing them for strep as well. These are just some basic things and just some basic tips. I hope it's helpful. And if you want me to touch base more on any of these, let me know. I do have a video on strep, and I did do a video on hand, foot, mouth a long time ago, but I can do a new one if anyone wants me to. All right, guys, thanks for watching. Bye.